Imran Khan, Chairman of the Board of Governors of the Shaukat Khanum Memorial Trust, members of the Board of Governors, the Governor and the Chief Minister of the KPK, Your Excellency Mr. Philip Barton, the High Commissioner of the United Kingdom, donors, guests and members of the Peshawar commissioning team of the Shaukat Khanum Memorial Cancer Hospital and Research Centre, Peshawar. It's a great honour and privilege for me to welcome you all today as we inaugurate the Shaukat Khanum Hospital in Peshawar. We did hope we had invited Mr. Amir Haider Khan Hoti, the former Chief Minister of the KPK, to this event. His government gave us the prime property on which this hospital is built. He was unable to make it for personal reasons, but we'd like to acknowledge him in any case. And I'd also particularly like at this point to acknowledge another gentleman who will be very embarrassed when I do this, but nevertheless it's very important, Mr. Qazi Lake, who is with us here today, the former chairman of the Peshawar Development Authority and the man who facilitated this process at every step. So this is the difficult bit now. A few words in Pashto initially to mark this day. And please bear with me. Nan yaw der loye vraz de Shaukat Khanum de para, de Pakhtunkhwa khalko de para, au tol Pakistan de para. Nan de Shaukat Khanum Lahore ye vishtuma kamal de. Kal de, sorry. I hope that wasn't completely inappropriate. Panan raz munga der fakhar sara, dwaim Shaukat Khanum iftita ko, dalta Peshawar ke. Zatasu tolo ta dera manan navaim, che tasu rustu pinzavish kala zamung marasta uka, aus tasu dera manana che tasu nan raghe. Munga tol donors ta, au aga tolo ta der shukar guzariyo, sok che Shaukat Khanum Peshawar design, tamir, au takmil ke zamung madadgar vu. Yad satay, Das tasu hospital de, da Pakistan khalko jod kade de, sirf tasu musalsal tawun sarabeda tarakki kai, inshallah da zargunu marizano ilaj bakai. I'd especially like to thank my colleague Dr. Afshan Khattak, who's a consultant pediatrician at Shaukat Khanum in Lahore, who helped me write this. So this is a very special day for all of us here, for the people of the KPK and for all the people of Pakistan. Today, as the Shaukat Khanum Hospital in Lahore celebrates the 21st anniversary of its inauguration, we usher in a new dawn in healthcare for the people of the KPK with the inauguration of the Shaukat Khanum Memorial Cancer Hospital and Research Centre in Peshawar. It is estimated that between 150,000 and 200,000 new cancers are diagnosed in Pakistan each year. At the Shaukat Khanum Memorial Cancer Hospital in Lahore, we now accept and treat over 9,000 of these new cancers annually. But we're unable, through capacity constraints, to accept much more than this. A country the size of Pakistan needs between 15 and 20 specialized cancer hospitals, the size of ours in Lahore, in order to adequately treat the number of new cancers we see each year in this country. We were offered land to build a cancer hospital in Peshawar in 2010 by the government of the KPK. Given that almost 25% of the patients that we see and treat at Shaukat Khanum in Lahore are from the KPK and FATA, we felt this represented a tremendous opportunity to help the people of this region, irrespective of their ability to pay, to access world-class cancer care. A small Peshawar working group was formulated and our Board of Governors approved the project in early 2011. Detailed plans were then formulated, the design being undertaken by a US firm of architects who specialize in the design of cancer hospitals all over the world. This same firm had previously designed our hospital in Lahore in the early 90s. Mr. Amir Haider Khan Hoti, the then Chief Minister, laid the foundation stone to mark the commencement of construction work at this site on the 9th of March 2013. The hospital you see before you today has been constructed and equipped at a total cost of 4 billion rupees. That's 4,000 million rupees. It's an 8-level structure with 2 basement levels, one of which is given over entirely to car parking, a ground floor and 5 upper levels. The building is approximately 33% larger than the hospital in Lahore. And we have not only improved upon that original design in every way, but have built additional capacity so that this building will be sufficient, inshallah, for our needs for the next 30 to 40 years. The hospital is designed to comply with all local, national and international building codes, and is also fully compliant with the requirements of the main hospital accreditation body in the United States, the Joint Commission. It is planned to be a complete tertiary care cancer facility with all cancer-related services under one roof, just as the hospital in Lahore is. We moved our walk-in clinic here almost 2 years ago, and even today our walk-in clinic is functional. We've moved it across the road to an alternative facility so as to facilitate our patients and prevent any disruption in clinical activity. And inshallah, we will be commencing outpatient clinics, inpatient beds, an intensive care unit, chemotherapy beds, a full-service pathology laboratory, and the full range of radiology services, including X-ray, ultrasound, mammography, CT, and MRI. All of this starts functioning tomorrow morning, 8 a.m. Inshallah, we will also be installing the first PET-CT scanner north of Lahore, here at this hospital in April 2016, 4 months from now. Thereafter, we will be commencing radiotherapy services in 2017 to 2018, with the commencement of surgical services expected about a year later. Throughout this time, there will be continuous increases in the existing services, including inpatient beds and so forth, as required. This hospital is designed to work to the same exacting standards as the one in Lahore. Both hospitals will work closely together, and it is very likely that in time there will be a steady flow of patients back and forth between the two facilities as areas of clinical expertise and excellence develop in each location. Almost all the staff has been recruited locally, trained in Lahore, and now returns to commence clinical functions in Peshawar. I'm going to digress for a moment to embarrass another gentleman, a very special man who has gone largely unmentioned so far, and without whom we would not be here today. He knows who he is. Dr. Naushirwan Barki is a professor of medicine at the University of Connecticut in the United States, a member of the Board of Governors of the Shaukat Khanum Memorial Trust, and the Chief Medical Advisor to the Board of Governors. He's currently also heavily invested in the healthcare reforms process in the KPK, a truly Herculean task in which he is working to improve the standards of healthcare delivery across the province. He is the man who designed and built the hospital in Lahore and who has also been largely responsible for the design of this hospital. With my friend and colleague, Dr. Faisal Sultan, he has also overseen its construction. He has been constantly available to us for advice and support, and with his limitless energy has been a source of inspiration to us all. Please join me in giving him a big round of applause. I would also like to thank my colleagues from the hospital in Lahore, who are in the third row here on either side, who as part of the Peshawar commissioning team have worked selflessly and tirelessly over the past 15 months in order to bring this project to fruition. They have brought their superb work ethic and the highest standards of professionalism to bear on this task, and can be rightly proud today of their tremendous achievement. You will see some of them later on in this ceremony, but there are, of course, many other unsung heroes who have contributed quietly, but very significantly, not all of whom could be here today. Here at Shaukat Khanum, our core values remain quality and equality. We are committed to providing the best possible facilities for the diagnosis and treatment of cancer, irrespective of the patient's ability to pay. To this end, over 75% of our cancer patients are treated completely free. Since we commenced operations in Lahore 21 years ago, today, we have spent over 20 billion rupees in providing free cancer treatment to those unable to pay for their own care. None of this would have been possible without the generous support of all of you, our donors, and of many thousands more like you who could not be here today. But remember, as a great man once said, today is not the end. This is not even the beginning of the end. This is only the end of the beginning. Today, as this new hospital in Peshawar commences clinical function, and as it expands in the coming years, when plans for a third Shaukat Khanum Memorial Cancer Hospital in Karachi are already being developed, And while the mother hospital in Lahore continues to grow and flourish, we need and count on your support more than ever to help us in our mission to provide world-class cancer care, irrespective of the patient's ability to pay, to all the people of Pakistan. May God bless you all, and may God bless Pakistan.